All right, next we have the term with. And we've looked at this many times in our coding. Did I lose everybody?
We are here.
We are
I'm
here.
here.
Can you see my screen, Eugenia? There we are.
Yes, I can see.
Oh boy.
I can see you as well.
We are
Okay,
following
good.
keenly. Yeah, we are following.
Okay. So we're good. We're back to looking at the slides.
Yes.
Thank you. All right. I am so sorry. All right, let's talk about the word with now.
Okay.
All right, so we know that when the word with appears, that it's to be in, that we can interpret it as associated with or due to when it's in the code title. So if we have conditions that are linked by this relational term, then we need to know that these conditions are documented by the provider. The word with in the alphabetic index is sequenced immediately following the main term. It's not going to be in alphabetical order. So when you look in your index for with, you know it's going to be directly under your condition that you're coding. An example here is when acidosis, when you have a type 1 diabetic with acidosis. If you reference acidosis and refer to type 1 diabetes, E10.10 is type 1 diabetes with ketoacidosis without coma. And what I'm going to do here is actually pull up the code. We can see here.
Yeah.
And we have coded diabetes quite a bit through this course and in our patients. So there's not two codes needed here. Basically, it's what I want you to know. This is a combination code. So if we have diabetes and we have acidosis, we only need one code. All right, so what about the patient that comes in with esophagitis and GI bleeding? And the documentation, the physician indicates that the bleeding was due to another cause. So you're going to code the esophagitis without the bleeding. And then you're going to code the bleeding as to where it was located. We do not have that in our documentation.
No.
No.
But if we did, when we have the chart in front of us, we're going to know.
There's a different code, right?
Yes. So you're going to code the esophagitis, which we've got. Yeah, I pulled up the wrong one. Let's do this again.
So
I'm typing and
Yeah.
Geez. All right.
Get it now.
All right, K20.90. If I pull this code up, it's without bleeding.
Yeah.
If it's identified as bleeding with the esophagitis and their physician is linking it, then our code will be different. All right, we will have to go back and identify the with bleeding. Now, remember, as you're learning, working in an environment, an employment environment, open up your codes, look at all your excludes notes, your use additional instructions. Become familiar with all those.